So I'm going to run through this. It's going to take a few minutes, but
Sure.
guys, I promise you, this is invaluable information. It's something that you can save to your computers. It's something that you want to share with your family and friends. And it's going to address it from both sides. It'll address it from the side of being on Medicare as well on ACA.
Okay.
So one of the first things you want to do, if you are not computer savvy, you want to find that grandkid or that daughter, son, or whomever.
Mommy, are you listening?
Well, in your family, you're the one, so.
Yeah.
You want to create that online account. Mm-hmm. Okay, that gives you visibility to maybe the messages you're not receiving. It gives you the ability to download your card. It gives you the ability to change your doctor, making sure everything is aligned.
Sure.
It also is your centralized place to go if you should decide you want to change your doctor or change your specialist. Everything is there for you to do the search to change that information. But creating an online account connects you and it connects you directly to the insurance company, and it provides you with access to all of your information.
And I want to say, yes, I did that after I signed up
Yes.
with you. I did that, and I had a different doctor.
Right.
And as soon as I was able to sign up, I was able to change my doctor. So
See?
it was
A living
amazing.
witness.
Yeah, and I think this was last week
Yes.
or when is I came home and there were 3 cards from Community Health Choice. And by the way, Mr. Jenkins is the one who gave us the plan. He saved us money.
Yes.
And it's heck decent amount of money, by the way.
Yes, a lot.
He's saving us. So, and that includes that we have the doctor that we want, it's in network, and the hospital that we would prefer to go if something happens to us, that's in network as well. With having said that, our annual out-of-pocket is much lower than what it was with the previous insurance, and the premium was probably 30-40% more we were paying. So,
Yep.
Yeah, and that's something you look at every year. I mean, things change. You
Yeah.
know, I always reference our body. You know, our bodies change from one year
Yes.
to the next.
Yes.
And I was joking with a young lady, and she said, "I only gained 1 pound last year." So you know what? That is awesome. But if you gain 1 pound 1 year for 30 years, the circumference is
That's a lot of hey, I gained a lot of weight in 2020. So yeah, let's not get about weight now.
so
going back to the original thing, the reason I mentioned that was because I came home and I saw 3 ID cards. 2 were on her name. There was 2 different doctors on, and mine was the one that I don't prefer to go to my PCP. So I asked her, I said, "Where's mine?" She's like, "Well, I ordered yours later."
So I do all the technical stuff. I made his account, changed the doctor, did everything for him, and now he got the new IDs with the correct doctor. So we're so
Exactly.
happy.
So that's a great segue. On the checklist, that's the second thing on the checklist. Verify the physician, select its correct physician, and they're in network. And that's both. That's 2 things, okay? That's your primary care physician, and that's your specialist.
Right.
They're very different, okay? And also for some, the gentleman I was working with out of Victoria last night, if you have children on your policy, so I want to make sure the pediatrician is, which goes right into the next thing on the checklist. Save the doctor's phone number in your cell phone.
Yes.
Because, you know, unfortunately, this week I experienced, you know, actually your dad was giving me a call, but I was, you know, caught up with a client. So we do what we call as a wellness check. Anytime we engage with someone in the enrollment process, we make notes. And if there seem to be a lot of medical issues, it's not within what we're supposed to do. It's just a value add of being a part of the Simple Choice Insurance family. And she was referred to me by an existing client. Long story short, she didn't sound good on the phone.
Oh.
She just didn't. She said, "I was up all night long, you know. My blood pressure is way up there. She lives alone, doesn't have transportation." I said, okay, and I hung up the phone. I just wouldn't let it go. So this is one of the things this is why you want to stay engaged with your insurance agent. I call extended family member.
Yes. You should have his number also on your speed dial.
Exactly.
Mr. Jenkins.
So what I did is I couldn't let it go. So I called the insurance company. Now I will say it's one of my favorites. You know, your mother has the same plan. I called and said, "Look, I just talked to this client. It doesn't sound good." And many people know you can do this. As your broker, I can do this. I said, "Look, I need triage done with my client. I don't like the way she sounds on the phone." So I was able to get a nurse to call her. Didn't get off the phone to her until the ambulance got there, because he said when she got to the emergency room, she had 4 canisters of fluid taken out of her lungs.
Oh my God.
This last night?
This was Wednesday. This was Wednesday.
Oh wow.
4 canisters. So if I was not checking in on those clients,
Right.
she hadn't slept in 2 days.
Oh.
And the nurse and the insurance company called me back and said thank you, because if she'd have stayed in the situation she went, you may not be talking. Within the next couple of days, it would have been over. because she has AFib and all that fluid was building up on her. And I was sensitive to it. I knew that because that's when my grandmother passed away of the fluid, the ability of fluid. So
and I'm actually glad you mentioned that, because I think just our South Asians people, we like to procrastinate when it comes to health. Like, even if we are not feeling too well, we be like, we don't want to go to the doctor, we don't want to do this. So that is a great thing if Simple Choice Insurance Brokerage is checking on you and you have your insurance. So always go out there, take care of your health.
Yeah, and I actually tell people, if you're very healthy, I'm probably not going to tell you to save my cell phone number in your phone. But if you do have health issues, I always tell those clients to save my personal cell phone number in their phone, because if there are issues, and if it happens at night or on the weekend, you're not going to get the insurance company.
Yeah.
And in those situations, they're on medication, not thinking clearly. So it gives me the opportunity to serve.
I know for sure you're on number one dial on my mom's phone for sure. Not even my dad, but definitely you are there.
Every time I see her, I can't do anything but smile. It just it's funny. I look at her, I just start smiling. Next thing is, this is very important. Contact your physician and let them know that your insurance plan has changed. Go ahead and get all the information updated in the system. Give them your ID number. Verify it's still in network if your plan did not change, because you can have a plan and the next year that doctor may or may not be in that same plan, even if you don't change. So make sure they have all that updated information, then schedule your first appointment.
Right.
Now, I encourage people to do their enrollment process the first part of October, first part of November, but we are past that point because that first quarter really stacks up heavily with the appointments. So, do all that you can to get it in that first quarter, but go ahead and get it out the way. And this is the reason why. This is a nugget that's a little bit further down. So the reason you want to do that is that when you transition to a new physician or a new plan, you want to kind of structure it so, if any way possible, that your refills at the end of the year come in November or December. Why? You're traveling. You got transition if you may change plans. So if you have a 90-day supply that you're getting and you are able to do that in November or December for that supply, then it's going to carry you the first couple of months, because it's not easy. Even with that client I work with, it actually ended up being 2 or 3 that was in a similar situation, not as drastic. But I had to call in favors to get them into their doctor, because the doctors are booked up until like end of February, 1st of March.
Oh.
Everybody wants to do their physical?
Everybody want to get their physical out the way for the first year, or their cycle was like September or October on their refills. So now they're running out of medication.
I see.
So if you're in that situation, you are able to, if you have a relationship with your physician, ask them for samples. Always. I think every time you go, make it automatic. Oh, she's going to ask me for samples. You're right. I'm going to ask you for
That's a good one, actually.
ask for samples, because it's a cost saving.
Yeah.
Next thing is, understanding in your plan your co-pays and deductibles as it relates to going to the doctor. We don't want, many of us, I think women love surprises if they're flowers and gifts.
Oh, yeah.
Men, we don't like surprises if they're,
Bills?
bills.
But, I want to mention this. It's just probably I am OCD. So when I got the plan, I went ahead and made an Excel sheet out of it, understanding, writing, PCP deductible, specialist deductible, urgent care. I actually put that all together so that, and we have it on our drive. So when both of us, if I am not available, he has all the information. So that's just how I am. And
so you're preparing to go on the Medicare. 4 years early. 4 years early.
Oh, no, you're faster. Thank you for the compliment,
though. I was trying to be nice. See there? See, I was trying to pay her a compliment like she was 25, so she still had 40 years to go.
Yes, I am 25. I like that. You made my Saturday.
Absolutely. But understanding that, because, for many of you listening to the radio, is, paying an unexpected $30 or $40 or $25 is not big of that deal.
Yes.
We don't want to do it. But for some people, they don't have that extra resource.
Right.
So there are literally people that are out there that we have to be sensitive to, that if it costs $25, $30 to go to the doctor, they don't have it.
Yeah.
So they don't go. So understanding that dynamics, even when I'm working with a client, they want the best of the best, I ask them about their budget and their extra, disposable income. So that if something comes up, you can go make that payment for that. If not, I'm going to put you on something different to make sure you can get your basic care as needed. Which segues into the most important part of a health insurance plan. That's your next to hospitalization is your medication.
Right.
So make sure you understand the cost of your medication. We have these. If you need one of those, we can send it out to you. We just got several hundred of the GoodRx cards. And believe it or not, on the GoodRx, there's a few others out there. When it comes to your medication, it's not uncommon for the GoodRx to be at a lower cost. And this is something I learned, is we'll mention later on in the show, is that the cost to a physician for the medication is much different than the cost it is to you.
Oh, okay.
It's like for those, I'm sure many in the South Asian market know what wholesale is, right? It's the wholesale. So they actually get a wholesale cost, so it's significantly less. So one of the things that some of the discount companies are doing, they're reducing some of that I don't want to call it waste, some of that profit margin.
I see.
And now you're able to get those medications either free or at a much reduced cost. So I think everybody should have a GoodRx or some type of discount card and then compare those medications. The kicker in this is that, every year there's new plans introduced in the marketplace. And they are incredibly cheap. A lot of them are $0 or less than $10, $20.
Yes.
But you have to read the fine print, right? So one of the things they don't see in those plans sometimes is that your deductible is a part of your medications are a part of the deductible, which means that whether it be your blood work or your medications or a CAT scan, MRI, X-rays, you got to pay for those things out of pocket.
Till you meet your deductible.
Meet the deductible. So now that $0 plan now costs you $6,000 because you got to pay $6,000 before you meet that deductible for the plan. So be conscious, understand that if I need my medication, how much is it going to cost? Now, fortunately, if you're on Medicare, you don't have those type of deductibles. But on a group plan or an ACA plan, you very well could have that situation. So, a lot of your Medicare plans, they will have like a $430 deductible or something like that associated with it. But understanding what are the costs for me to get my medication and keeping up with where you are in that cycle. The next thing is the urgent care. This causes me pain and it's always my fault. I get that's part of being a male, that I understand that when you're in a relationship, it's always your fault. It doesn't matter if you're right or wrong, but it's always your fault. But
did you
why
hear
you
that?
look at Cecile? It's kind of funny. He just got it. He didn't say nothing. He said, I have to go home with him. I have to go home with him.
Sushil is very good with selective hearing. He's like, I didn't listen to that.
So whenever you talk about money, normally when you talk about money, it's savings, number one, or making money. My ears go up automatically, and all the possible sources of hearing, from wherever it is, it opens up, right?
It opens up.
But whenever you talk about some other stuff, no, everything just shuts down.
It just shuts down. Someone told me once, it's not that it's too expensive, it's that you're not resourceful enough.
Right.
I don't know if I buy into that, but
well, in a way, it's true. The resources in the bank are probably less, but yes.
Find a way.
Yeah.
So when I get to urgent care, because we want to kind of stay away from the emergency room. Emergency room is more expensive for everyone, but if you need to go, don't hesitate to go. And if you are in an HMO plan and you're out of network, you must go to the emergency room.
Okay.
So that's a segue to keep in mind too. If you have an HMO plan, now when you're out of network, say you have a plan that's regionalized here in Houston,
right,
and say you're in Dallas, and you break your arm. Okay, you go into the emergency room. So those emergencies are covered in those situations.
So they kind of become in-network, is it?
Yes.
Okay.
And even on the same thing with the Medicare plans. On your Medicare plans, you're in part of a network, but if you outside of that network, you have an emergency, you go to the emergency room, they take care of you. It's not an issue. Then they work on getting you back to, once stabilized, getting you back into in-network.
Right. So that's one piece of information that we had no idea about, and Mr. Jenkins told us, that if you have a life-threatening emergency, like you mentioned, a broken arm, and if you go to an emergency room which is non-network, it automatically becomes in-network because you have a life-threatening emergency. So guys,
exactly.
That's why it's very important to have Mr. Jenkins in your life, because he has a wealth of knowledge on things that we don't know.
And even with the urgent care. So please, in your plan, determine which urgent care facilities that are in your area go ahead and put that in your phone. So inevitably something is going to happen. You're not trying to figure it out and go to the wrong place, something that's out of network, that there's something that was in network was a mile away.
Yeah.
Because a lot of times those situations, you're looking at about a $1,600 bill. I actually went last week, and just, always trying to learn more about the differences and what the costs are. I was told about emergency care, it's not unheard of. You literally could be in emergency care, the freestanding building. You literally can be there all night long, and it costs you $20,000.
Oh, wow.
That's a lot.
Wow.
That's almost as much as your wedding ring.
Yeah.
Yeah.
It's
Hypothetically speaking.
But yeah, it can be very expensive. So, and all this is preventative, guys. There isn't a bad insurance plan if you understand how it works and you prepare for it at the beginning of the year. So putting that in your phone, knowing where I can go as an urgent care facility. So if I wake up and just not feeling good, you know what? I can go to urgent care and I can pay a copay of $10 or nothing, because some of the plans are nothing, or $20, $30, $40. You can do that in somewhere close by. Do the same thing with the hospital. Just verifying that your hospital of choice, which should have been done on the front end, but I know I'm speaking with people. I've trained literally thousands of agents. I've worked with city governments on these types of plans and programs, and I know that the average person you talk to that enrolls you in your plan are not going to go through this process with you.
Right.
They're not going to discuss these things. But just doing that, taking this document and just every year going through it, getting those things in line, it makes for a much better experience. The next thing is being clear about if you're on a PPO, EPO, or HMO. In every conversation I have, I'm always going to bring those things up.
Right.
Because they seem to be the most, it's a common term in the industry, but it's the most confusing. And I have the issue again and again and again. So the thing I'm going to bring out to you is the HMO. If with an HMO, keep it in mind, before you receive any type of care, except for going to the emergency room, you must see your PCP first.
To getting a permission to go to the specialist.
Exactly.
Referral, yeah.
Exactly. Because the referral to specialists are different.
Yes.
That specialist, whether it be endocrinologist, cardiologist, whatever, rheumatologist, whatever it may be.
Liver specialist.
Nephrologist, no matter what it is,
Kidney specialist.
they specializes on that. Your PCP is looking at your overall general health.
Yeah.
And they're sort of like the collector of data. Right? So you want to make sure you're dealing with someone in network that information can be shared easily. They can, they're not starting from scratch. So they want to make sure it's correctly assessed correctly, then they refer to you someone that's in network. So make sure, for example, if you need a physical therapy, I had a young client do this last week. He went on the plan, and day 4, he was getting ready to get surgery. I'm like, but when did you see your PCP? He said, what do you mean?
Oh.
So he had scheduled a surgery, getting ready to pay out of pocket over $3,000. I'm like, there's an opportunity to do things differently.
Go see a PCP. Maybe you pay maybe $500.
Yeah. And I asked him, well, how much was your doctor visit to your specialist? He said $250. I'm like, it was supposed to be $5.
Yeah. Wow. What a difference.
But you know what? Also, I have clients to me all the time. Shame on that physician's office.
Yeah.
Because they know. They should say you need pre-authorization for this. Any surgery that you have, whether it's PPO, HMO, or I don't know, you must have your PCP involved in that process, and they understand there's a sharing of data. It's just a natural workflow of how things are supposed to work. And the last 2 things is blood work, making sure that if you don't have a complete doctor visit if you don't get blood work done.
Sure.
That's how you determine.
Right.
It's like I'm gonna pull your tooth, but I'm not gonna do an X-ray.
Yeah, that's exactly what it is. No, it's very important. I think every year to get that blood work done is really, really important.
Because you can catch a lot of things in your blood work.
Yeah.
So all these things I'm mentioning, it should be your checklist of what you're asking that insurance agent that you work for. People say, well, why you share this information? Well, I'm more of a healthcare advocate. I just want everybody to be better, because directly or indirectly, it all costs us money through taxes.
Right.
Because there's a population that we pay for their health insurance through what they call indigent care programs.
Yes.
And Houston has one of the largest indigent care programs in the country. So a part of our tax dollars, along with other things, go to provide those services. In the India House, and a lot of the physicians, they volunteer time
Yes.
to do that. So It is a cost. So making sure that blood work, you understand the cost. Is it free or is there a copay associated with that? And the last two things, number one, if you're on Medicare, checking to see if that plan has transportation.
Oh, okay. So they pick you to the hospital or doctor.
And you'd be surprised how many people that are on Medicare. I dealt with this with my father because he's losing his hearing, and when I was at home, I said, I called my father, Pop. I said, Pop, that's not what they said. He said, well, it's what they should have said. So, a lot of our parents are very prideful. They've done well in life, and they're very prideful. But there is going to come a time that sometimes Pop doesn't need to drive. My father's not there yet, or that individual now, her husband has passed on, or the husband is at work and busy, but knowing that they have that transportation.
Yeah.
So almost all of your HMO plans and almost none of your PPO plans have transportation. And if you're on a Medicare supplement, it does not have transportation included in those plans.
A joke on that. My mom had to go see a doctor on Monday. She'd got an appointment. And she drives, but she is not very comfortable with using a GPS, or she's not very comfortable with getting to the doctor. So you know what she made my dad do? She made him take her there on a Sunday. She memorized the route, and I guess she bought him some lunch for that. And then after that, she went there on Monday. So, Mom, this is for you. They provide transportation. Call Mr. Jenkins again. Bother him more.
Why don't you guys take a song break and come back?
Yeah. And the last point I think you had, and then we'll take a song break.
Yeah, dental. Your dental and vision, that's kind of the pathway to what's going on inside your business. A dentist can look at your teeth and tell there things are going on.
Right.
And an optometrist can definitely look at your eyes and tell what's going on in your body. So making sure that, a lot of times you get the health side of things. Dental and vision is not considered to be a part of traditional healthcare. They are supplemental things, but they are crucial. I'm sure if you met yourself in if he was missing a couple of teeth up here, the relationship might have gone in a different direction, right?